Hello, I'm Dia Smith Taylor, and welcome to the after show of House Calls. We're back, and this is the show after our live show where we talk to our doctor to answer more of your pressing questions. And today joining us is Dr. Donald Lloyd Jones. Doctor, welcome back to the show, and thank you so much. We had a great live show today, wouldn't you say?
I would say thanks, Dia. Yeah, it's great to be back with you. I know there were a lot of questions we couldn't get to, so I'm eager to see if we can help out.
Absolutely. So, of course, we were talking about heart disease, and one question that came from Facebook asks, what is the efficacy of taking turmeric? Does it work well for heart health?
So it's a great question. I think we can kind of broaden the answer to think about lots of different supplements. And the most important thing we can do for heart health is eat a really well-balanced diet, high in fruits and vegetables, avoiding simple starches and sugars, keeping our protein lean. Those are the real keys. Taking a supplement beyond that or using something like turmeric, I don't see any ways I think that it can hurt you, but I don't actually know of any well-done data that show significant heart benefits. Turmeric does have some properties, antioxidant, anti-inflammatories, that in animals seem to control some of the risk factors for heart disease. We have no data in humans showing that it actually helps reduce risks for heart attacks or strokes.
Really helpful information because we are on information overload, and so it's really good to have the science behind it, even if that means that what we've been doing isn't exactly what we thought it was. Next from YouTube, the question is, what actually causes low heart rate if you don't have heart disease and if you're not athletic?
So interesting question. So I guess important to define first, what are the normal range of heart rates? And for most people, anything between 60 and 100 in what we call normal sinus rhythm is a very normal resting heart rate. There are a number of people who have resting heart rates that are lower than that, as your viewer pointed out. Sometimes that can be because they're athletic. An athletic heart is more efficient, so it doesn't need to beat as rapidly to pump the same amount of blood per minute. So athletic folks do tend to have lower heart rates. But there are a number of other things that can cause low heart rate. Medication is one of those things for sure. Also just age. Some patients, the electrical system of the heart just slows down a little bit as they age, and that can lead to lower heart rate for sure. And then there's some rare things that are congenital that can lead to lower heart rates, but those are not common.
Really interesting. I never thought of being athletic as having a lower heart rate, but that's a good thing.
It's a very good thing.
Good to know. We actually have another question from YouTube who wants to know, can you recommend the best fruits and vegetables for heart health?
Yeah, in general, leafy greens are really great. All vegetables are really pretty good. The fats in vegetables, if they're there, tend to be pretty healthy overall. So vegetables in general, a good class of things to be eating more of. Within the fruits, there are some that do have more simple sugars in them. So generally speaking, the firmer the fruit, that is to say the less fleshy it is, generally speaking, the more fiber and the better it will be for you. So things like apples are great. Some of the citrus fruits, although they have a little extra sugar, but they got a lot of fiber. Berries are probably nature's perfect food. Lots of fiber, not as much sugar. So they're a great fruit choice. But things like pears and bananas, more sugar, not quite as helpful potentially. And grapes are tough because we eat so many of them that you do end up actually getting a fair amount of sugar with grapes. But in general, I think focusing on things like apples and berries, really good choices in the fruit class.
Oh, that's good to know. That's great, actually, great information. This is an interesting question. What causes Afib after a heart attack? But before answering that, can you define Afib?
Sure. So Afib stands for atrial fibrillation. It's an abnormal, irregular rhythm of the upper chambers of the heart. And it can happen for a variety of reasons, but the reason we worry about it is not so much that it's an irregular rhythm, it's that when the heart is in atrial fibrillation, the upper chamber of the heart doesn't contract vigorously to push the blood through. it kind of just wiggles. And when the heart is doing that, the blood can pool inside that chamber. Anytime blood sits still, it wants to clot. So you can form a blood clot inside your heart when you're in atrial fibrillation. If that blood clot then breaks off, it's going to go somewhere we don't want it to go, most often to the brain, causing a stroke. So atrial fibrillation is something we really want to know if you have it, and we want to treat it if you do have it, particularly to lower your risk of stroke with a blood thinner. Now, why might you get it after a heart attack? Well, it turns out that the risk factors for atrial fibrillation are the same as the risk factors for heart attack. So those same things that put you at risk for the heart attack might put you at risk for atrial fibrillation also. But if there's been enough damage to the heart muscle with a heart attack, that can also increase the stress and the stretch on that upper chamber where atrial fibrillation occurs, and that can trigger more atrial fibrillation in people who are prone to it.
And last question, what can stop tachycardia? And again, I'm going to ask you to define that and help us to understand a little better.
Yeah, so tachycardia is kind of a bucket for describing any rapid heart rhythm. So some tachycardias are normal. Normal sinus tachycardia occurs, for example, when we exercise. So your heart rate goes above 100, but it's physiologic. It's in response to something that we're doing, where your heart rate should go higher. There are other tachycardias that are more spontaneous or intrinsic to the heart, where the heart is demonstrating some irritability in its electrical system. So if you have it, it's really important to know a couple things. One, where's it coming from? Upper chambers or lower chambers of the heart? And two, is your heart otherwise structurally normal? If your heart is structurally normal and you have some form of tachycardia, then in general, your prognosis is much more benign, and we can treat those tachycardias more because of the symptoms rather than having to get aggressive with the underlying problem. If you don't have a structurally normal heart, or if your tachycardia makes your heart go really fast so that you might pass out, then we do need to get more aggressive with those, and that sometimes requires medication, sometimes requires something we call ablation, where we map where that rhythm is arising in the heart. We try to zap it with radio waves to knock it out so that that part of the heart circuitry can't cause this rapid heart rhythm. So lots of different treatment strategies. If you are on your own and you know what your diagnosis of tachycardia is, there are ways you can potentially manage it. For some patients, drinking cold water. For other patients, holding their breath and bearing down. Sometimes that can limit an episode, but I wouldn't try those things unless you and your doctor know exactly what the mechanism of your tachycardia is and whether that will work for it.
And I'm going to slip in a question of my own since we're approaching Thanksgiving. Is there any foods that we should definitely stay away from?
You're going to put me on the spot here. I think I'm a big believer in moderation, right? That of course we should enjoy ourselves, and of course eating is just such an important social activity, especially these days.
Mm-hmm.
So I think if you're going to have things that are less good for you, be moderate about it, or maybe do an extra workout so you earn that extra piece of apple pie or something. But moderation, I think, is the key to so much of what we need to do with our lifestyle.
That brings us to a close. Thank you so much, Dr. Lloyd-Jones. This has been a great segment. And for those of you who are watching or listening, listen, you have an opportunity to also have your questions answered either on the live show or on the after show. Thank you so much for joining us, and tune in with us next week for our next House Calls. We'll be live. See you then.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.